Galleizi fracture is a radial head fracture with disruption of drudge. Uh, galleizi fractures are unstable fractures and undergo surgical fixation of the radius. Distal 1/3 radius fracture with associated drudge injury. Drudge is more stable in supination. Uh, Drudge rejection, if unstable, reduce and pin it in supination for 6 weeks, or a large ulnar styloid fracture. If it is there, you need to fix it. Sign of drudge injury is ulnar styloid fracture, number 1. Number 2, widening displacement of AP and lateral views and radial shortening more than 5 millimeter. Irreducible drudge anatomical reduction is required. Interposition of tendon is possible, that is ECU or periosteum. A gap in fluoroscopy imaging require open reduction to remove interposed material. Sometimes you need a dorsal approach to reduce the drudge. Always check wrist and elbow x-rays. If both forearm fractures, a radial bow restoration is very important. Henry approach for middle and distal third, and Thompson approach for the middle and proximal third. Always stabilize more difficult fracture first. It always tend to be the radius first. Long plate preferred due to the high torsional stress in forearm. Absolute stability by 3.5 screws, either through or separate from the plate. All both bone forearm fractures should undergo RIF, 2 incision technique to avoid synostosis. Isolated ulnar fracture is a green stick fracture. Isolated non-displaced or distal 2/3 fracture with less than 10 degree of translation and 10 degree of less than 10 degree angulation can be managed non-operatively. Isolated proximal 1/3 and distal 1/3 fracture with greater displacement should undergo RIF. Pediatric forearm fractures less than 10 years, angulation of more than 15 degree and rotation of 45 degrees. And more than 10 years, angulation of more than 10 degree and rotation of 30 degrees. Bayonet apposition in more than 10 years is acceptable. More than 13 years of age would need anatomic reduction like adults.